Hello everyone, I'm Dr. Adam Maulana. How are you today? I hope you and your family are always blessed with good health, peace, happiness, and protection in everything you do. Thank you for joining me again and taking the time to learn about ear health and hearing. Today, we're going to discuss how hearing loss affecting one ear can be managed. Every person's condition is different, so the approach recommended by a doctor may also vary. Management generally depends on the underlying cause, the degree of hearing difficulty, the condition of the ear, and each person's communication needs. The video material used as one of the references for this discussion comes from Clinic Al-Bairuni, particularly its educational content about ear health and different options that may support people experiencing hearing difficulties. This information has been summarized into an educational discussion to make it easier to understand. The first thing to understand is that management should begin by identifying the underlying cause. For example, if reduced hearing in one ear is related to earwax buildup blocking the ear canal, a doctor may perform an appropriate ear cleaning procedure. Depending on the condition of the ear, the doctor may use ear irrigation or another suitable method. However, we should not clean the ear carelessly at home, especially by inserting objects deeply into the ear canal. This habit can push earwax farther inside or irritate the ear canal. But what if the cause is related to a permanent change in the hearing system? In such situations, a doctor may consider several hearing devices and communication support technologies. The choice should always be based on a proper evaluation. One possible option is CROS, or Contralateral Routing of Signal. This system is designed to help people who have very limited hearing on one side by transmitting sounds from that side to the ear with better hearing. With this type of system, sounds coming from the side with reduced hearing may become easier to detect, particularly when someone is speaking from that direction. Another option is a cochlear implant. This device is different from a conventional hearing aid. A cochlear implant uses an electronic system to provide stimulation to the auditory pathway in certain individuals who meet specific medical criteria. However, a cochlear implant is not automatically recommended for everyone with hearing loss in one ear. Doctors and audiology teams need to conduct a comprehensive assessment to determine whether someone meets the appropriate criteria and whether the expected benefits are suitable for that individual. There are also bone-anchored hearing systems. These technologies use vibrations transmitted through the skull to reach the inner ear. They may be considered in certain situations, particularly when the normal pathway for transmitting sound through the outer or middle ear is affected. Another option is an FM system or wireless sound transmission system. This type of technology can help make a speaker's voice easier to hear in certain environments, particularly when background noise is present. Such systems may be useful in environments such as classrooms, workplaces, or other communication settings, depending on the individual's needs and the available technology. What we need to understand is that there is no single device that is suitable for everyone. Two people with hearing difficulties affecting one ear may not necessarily benefit from the same technology. That is why an evaluation by an ENT doctor and audiologist is important. The assessment may include an examination of the ear, hearing tests, and an evaluation of how the hearing difficulty affects everyday communication. Doctors may also consider other factors, such as age, the hearing condition of the better hearing ear, daily activities, work environment, communication needs, and the individual's expectations regarding the device. In addition to selecting an appropriate technology, auditory adaptation and rehabilitation may also be an important part of the process. A person may need time to become accustomed to the sounds produced by a particular device. Consistent use and guidance from hearing professionals can support this adjustment process. Another important point is protecting the ear that still has better hearing. Avoid excessive noise exposure, use appropriate hearing protection in noisy environments, and avoid inserting objects unnecessarily into the ear canal. If hearing in one ear changes suddenly, do not simply assume that it is an ordinary ear problem. Medical evaluation is important so that the underlying cause can be identified and appropriate management can be considered. So, hearing loss affecting one ear does not necessarily mean that a person has to stop communicating or give up their usual activities. With appropriate evaluation and suitable technology, people can receive support to communicate more comfortably. The most important thing is not to choose a hearing device simply because someone else recommends it. Every ear is different. A device that works well for one person may not provide the same benefit to another. And the moral of the story is this: do not see hearing difficulties as the end of your ability to connect with the world. Understand your condition, seek professional evaluation calmly, and use the support that matches your individual needs. Because good health is not only about having perfect hearing, but also about continuing to communicate, value yourself, and live your life with confidence.